This episode of DocTalk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.
Hello, my name is Dr. Rob Page, and welcome to DocTalks. DocTalk, sorry, David. DocTalk is a podcast that is produced by the Knoxville Academy of Medicine and features its physician members giving information to patients that's helpful in terms of making their healthcare decisions. I feel so fortunate to have with me here tonight Dr. Matt Doppelt. Dr. Doppelt is a dermatologist who's been working in the Knoxville area for a long time, almost 2 decades now, I believe. And you are with Southeastern Dermatology, and you are here tonight to talk to us about something that may or may not be applicable, but it certainly is something that a lot of us probably need to know about, and that is tattoo removal. Welcome.
Thank you.
So what techniques, and we're going to talk about maybe some novel techniques or some different techniques. What has been available in the past if I'm someone who has the unfortunate tattoo regret? I misspelled my fiance's name. I don't have a fiance anymore. What are the techniques that we've used in the past, and why is this such a significant change that we have now?
Well, in the past, before we had lasers and other devices like that, surgical excision, you actually cut them out. True dermabrasion, where you just basically try to scrape away the ink. Putting different acids on there, and all of these, they would be somewhat effective, but the scarring that right. It's like you trade a scar for the tattoo. So fortunately, laser technology has evolved, and we had for a while some of these Q-switch ND YAG lasers, and they worked pretty well. You could get a lot of the tattoo to go away, but maybe not completely go away, and it would take sometimes 20 treatments or so. And these treatments are not exactly painless, and it's quite costly as well. It costs a lot more to remove a tattoo than it does to put one on. Mm-hmm. But the sort of the latest advancement to come out over the past 4 or 5 years have been the picosecond lasers. We brought a device into the office called the PicoSure, which was really kind of revolutionized this whole idea of tattoo removal. And it's this really short picosecond burst of energy from the laser that sort of shatters the pigment particles into small enough pieces that the body, macrophages and the body's garbage disposal system will come in, chew those things up and get rid of them.
So you mentioned some of the other technologies. So in terms of, if I'm a patient and perhaps I've had laser tattoo removal in the past, this is a completely different system.
We have a lot of patients who actually come in who've had tattoo removal somewhat successfully. Maybe they've gotten rid of 60% of the tattoo, but you can still see some of some of the residual pigment that's there, and we've had really nice success actually picking up sort of where some of the older technology sort of left off.
So and this is something that so let's say I'm a patient. I've a big night. I've gone out and I've had something tattooed, a tattoo done in an area where I don't want it. Are there any limitations to this? Is there any type of inks? I know that there are multiple inks that are used in tattoos. There's reds, there's, and nowadays there's all kinds of different colors that are used in tattoos. Then being, they get more and more. I've seen Ink Masters. I know, I know how complex these tattoos can come. So are there any limitations in terms of like the colors that they use, or the size of the tattoo, or?
There's not really a limitation in terms of the colors. The lasers that we have can pretty much remove all tattoo colors. Some of the tattoo colors are more challenging to remove than others. And what's really interesting about tattoos, well, there's a lot of interesting things about them.
Right.
We were sort of chatting earlier, like, why did you get the tattoo? Why do you want it removed? But
that's two stories.
Two stories. A lot of, of the success of tattoo removal depends on a number of different factors. So for instance, like if you have what we call an amateur tattoo, or some people may have like a jailhouse tattoo, these tattoos that aren't done professionally are usually the easiest ones to remove. Sometimes is like one session will sometimes just get rid of them, which is pretty fabulous. Other tattoos, the more professional tattoos that are done, the more inks that are involved, the deeper they are, the more the denser the spacing of the ink particles. All of these can sort of make it a little more challenging to remove the tattoos.
So it's so challenging, but not impossible. It may take more treatments, additional therapies. What about anatomically? Any place on the body that would be difficult, or you'd not be able to get the tattoo? I know sometimes they're in very private locations. Sometimes I know that people have had tattoos in the interiors of their mouth. Some places where you would think it would be very difficult to get them done. Are there any limitations in terms of the pico laser for doing that?
So anatomically, so long as we can sort of focus the beam in the right way, I don't think there's really a limitation on where we can do that. I have seen, I have heard of people who have gotten scleral tattoos. And I don't know how I would feel about. I haven't run into that yet, but but yeah, that might be a place where I wouldn't want to venture. But
right, I was going to say, I don't. Yeah, using a pico laser in someone's eye, I guess, would be a little bit difficult. But what about the interior of the mouth? Have you had any experience with that, or anyone who's, or is there any reports of being able to do those types of tattoos?
Yes, we have had experience removing sort of the inner lip tattoos, and actually works pretty well.
Wow. So, in the past, you mentioned some of the other therapies, and I even know that patients have had, people have had tattoos, and one of the strategies I know, because they've not been very effective in terms of being able to treat these with lasers, is that sometimes people get a tattoo over a tattoo. And then let's say I'm unhappy with that tattoo. Would that be something that I would also be able to get treated? If even after having two types of ink, a tattoo on top of a tattoo, would that be something that would be you'd not be able to treat with the pico laser?
You should still be able to treat it. What's really kind of interesting when you're removing these tattoos is sometimes you'll see that you'll sort of remove the newest tattoo seemingly first, and then the patient will say, "Oh yeah, that was the tattoo that I had, before that I was trying to cover up, or that was embellished or something like that." So.
And so, but you can treat that as well. That would not be a limitation to it. What sort of result? Despite the tattoo, I know you talked. Some of them take multiple treatments. What are we talking about on average? You said jailhouse tattoos, or the very simple tattoos, the home, the home done tattoos. Some that people do with like a pen, like a needle and maybe some ink would be fairly easy to treat. Maybe one treatment. What is the average, and what would generally be the maximum for like a larger tattoo?
So, for a professionally done tattoo, I typically say it's about half the number that you would have to use with one of the older technologies.
Okay.
But so I would say probably somewhere around maybe 10 or 8. Let's say 8 to 12 treatments, maybe more, but that's a pretty good number.
But it all depends. I mean, this is really individualized based upon the type of tattoo.
It's a real challenge to tell somebody I can remove that tattoo in this number of sessions. That's like I usually don't go that way because
you have to see how it's going to react first. And you have to see how difficult the ink is going to be to remove. So I'm a patient. This is something I'm interested in doing. I have a fairly large tattoo. What are we talking about generally in terms of cost?
So what we do is we actually have a telephone number set up, and I don't know what the telephone number is.
We'll have that.
We can
the
put it at the
telephone
bottom.
number will be right there at the bottom of the screen.
I'll make sure we get that.
He remembered it, and it's right there.
But the reason we have this set up is that you can actually text us a picture of your tattoo with like a coin or a ruler next to it, and then we can look at it and we can actually give you a quote, sort of like how many sessions we think that it might take and what the cost would be.
So this is not something that would be sprung on me at the end. So before I come in, I have a pretty good idea about how much it's going to cost to have this tattoo.
Correct.
And just on app for a small tattoo, what would we be talking about? As a general rule. I mean, so like let's say I've got a small tattoo of maybe coin-sized tattoo on my arm, or maybe something a little bit larger than that. What would the cost generally run on something like that?
It could be anywhere from like say, I'd say $500 to $1,500, something like that.
But something that would definitely be worth it, because it works, and I've seen the results that you've had before. I mean, I've seen these tattoos, and they are gone. I mean, there is nothing left. You can't even tell there was a tattoo there before. But as you mentioned, it really is individualized based upon what you guys can see. And so this would be something. So we have the number down there. So if you're interested in visiting Dr. Doppelt, take a picture of your tattoo. Make sure you have a reference picture, something, a coin, as you mentioned, something of fixed size next to it, so he knows what size it is, and then you can text that to that number, and you can get a good idea about how much that would cost. Any side effects, any bad things that we can be worried about from these treatments?
Well, so the tattoo removal is a little uncomfortable. There are things that we do that we can make it very comfortable for patients. After the tattoo is done, there can be some blistering, there can be some swelling, redness, that kind of thing. It's usually very manageable. And so it's just kind of, you got to kind of psych yourself up to, kind of going through this whole process.
Right. Well, if you psyched yourself up to get a tattoo, this is probably not as painful as getting the tattoo, right?
This is true.
And emotionally not as painful as well, probably.
Well, I tell patients that, it's really, it's much harder and more expensive to get rid of a tattoo than it is to get the tattoo.
But worth it, because if you want to get rid of a tattoo, this is the way to do it, because it's going to be gone.
Well, we can get most of these, pretty well resolved with, with the multiple treatments.
Well, and from what I've seen, I mean, the ones that I've seen, some of the results you've shown me and some of that, I've not been able to notice there's anything there. So maybe not necessarily perfection, but certainly much better than the technologies that we've had before. Certainly without all of the therapies that where you're talking 6 treatments now. It was 12 treatments before. Possible scarring from surgeries, dermabrasion. Just all the different forms that were there before. I mean, just certainly less painful, less time consuming, probably less expensive as well. So
well. Yeah, overall, it ends up being that way.
I was going to say, well, let's mention in terms of number of therapies, et cetera, and things like that.
Correct.
So, but if you want to know, you can find out by texting this number. So, if we're also interested in contacting your office or getting any additional information, you're with Southeastern Dermatology. Where is your office located, and how would I be able to contact you?
So the office is located right at the corner of North Shore and Pellissippi. If you know the area, there's a freestanding Starbucks that is there,
and you can see it in the drive-thru.
Yeah, and and you can we share a drive, the same common drive, but it's right behind where that Starbucks is. We practice medical, surgical, and cosmetic dermatology there. If you want to look on our website, we've got some before and afters of a lot of different things, including tattoos. That is www.drdoppelt.com. That's DRDOPPELT.com. And
I'm pretending it's going to be down.
It's going to be there. Phone number too.
Phone number, the whole 9 yards.
All right.
9 yards. So we'll have everything but a map. But anyway, they'll be able to get in touch with you and figure out where you are.
Perfect.
So Dr. Doppelt, thank you so much for joining me here tonight. And certainly something we're not accustomed to talking about in terms of like a medical procedure, but it certainly is something that needs to be managed by a physician. Certainly, whereas you didn't necessarily need a doctor to have it put on, you certainly need somebody managing it to take it off. And would certainly, and I think in a lot of situations, people who've had very extensive tattoos who maybe changed their life, their life partner, their life situation, it's something that can help. I mean, I'm sure emotionally it means a lot to a lot of patients as well.
It really, it can be life-changing for people, because a lot of times they have tattoos that are, sort of, stigma. It reminds them of, their old life that they want to leave behind, right? And move on, and so to be able to, remove those is very rewarding.
I was going to say, and probably priceless for the patient. So
absolutely,
excellent. Thank you so much. And with that, this concludes this episode of DocTalk. DocTalk is a podcast that is produced by the Knoxville Academy of Medicine and features its physician members giving information to patients that is helpful in terms of making their healthcare decisions. I'm Dr. Rob Page, and thank you so much for joining us here tonight.
This episode of DocTalk is brought to you by First Bank. We're not just your neighborhood bank, we're your neighbors. Our local team lives up to the name, putting our customers and community first. To experience First Bank difference, stop by any of our 13 Knoxville area locations or visit firstbankonline.com. First Bank, member FDIC.